Okay, good afternoon. Welcome to my exercise presentation. So we're going to talk about getting into an exercise routine. Okay, so most of you know who I am, but for those of you who do not, my name is Amanda Bruner. I have a bachelor's in exercise sports science from Texas State University. I've been a certified personal trainer for 12 years. Also a corrective exercise specialist, which I've been for 9 years. I've been with the Westminster family for 3, and I'm also a certified dementia practitioner. And then here's just a little picture of my family. So this is our first family portrait that we took. This is my husband, Corey, and my son, Asher, who is only 2.5 months old in this picture, and now he just turned a year old. Okay, so what you will learn today, we're going to learn about benefits of exercise for older adults, recommended amount of exercise for most older adults, general guidelines for exercise intensity, and how to stick with an exercise routine. So let's get started. Okay, so we're going to talk about benefits of exercise first. So some of the benefits, I'll go through them and then I'll go through each one and explain each of them. So longevity, increase energy and strength, lower the risk of chronic diseases, psychological benefits, improve sleep, and prevent falls. So the first one is longevity. Regular aerobic exercise lowers your resting heart rate. Aerobic activity improves your cardiovascular system's ability to circulate oxygen throughout your body, which is crucial to the health of all your organs. With a slew of healthy, well-functioning organs, including your heart, years can be added to your life expectancy. Lower the risk of chronic diseases. So the first one we'll talk about is osteoporosis. So regular exercise wards off osteoporosis by putting weight on the bones, strengthening the bones, and increasing bone density. It also lowers the risk of heart disease, high blood pressure, type 2 diabetes, stroke, and obesity. And then also helps you manage weight, lose excess weight, and prevent weight gain. So the next one is energy and strength. Regular exercise will help prevent your metabolism, energy levels, and muscle mass from slowly decreasing as you age. Strength exercises help you gain muscle mass, which increase your metabolism and gives you more energy. Exercise will also make your muscles and joints more flexible, ease aches and pains, and reduce the risk of falling. Psychological benefits. Exercise can relieve anxiety and depression, improve your mood, and prevent mental diseases such as Alzheimer's and dementia. Tai Chi and yoga are both great meditative exercises that benefit the mind. They work against depression and improve circulation to the brain. Improve sleep. So higher levels of physical activity can help exhaust the body enough to place it in a position for restful and lasting sleep. Try to avoid strenuous exercise 2 hours before bed to obtain these benefits, and aim to meet the daily activity recommendations. All right, so helping prevent falls. Improving muscle strength and bone density can be helpful in reducing the risk of falls, as it can also improve balance and flexibility. Regular exercise can reduce the risk of having a hip fracture by 40%. Okay, so how often should you exercise? Remember, something is always better than nothing. So going for a walk is going to be much better than sitting on your couch watching TV. The current recommendations for most older adults is to participate in at least 150 minutes of moderate activity per week. So 30 minutes 5 times a week. If you can't find 30 minutes in your busy schedule, I know some of you do have pretty busy schedules, it is okay to break things up. So for example, do 2 15-minute workouts each of those 5 days, or you can even break it up in 10-minute workouts. I mean, it can be just as effective. So really just want to focus on getting those 30 minutes for those 5 days. So how hard should you exercise? Whether an activity is low, moderate, or high, the intensity varies according to your personal fitness level. So for example, a brisk walk may be low intensity and really easy for someone who's more fit and works out like, every day. But it could be a really high intensity and a lot more difficult for someone who's never exercised before, or someone who exercises, maybe a couple times a month or something. So it does depend on your fitness levels as well. So how hard should you exercise? So as a general guideline, there's a low intensity, moderate, and high. So for low intensity, you can easily talk in full sentences. If you're working out at a moderate intensity, which is the recommended intensity that you should be doing or shoot for, you can speak in full sentences, but you can't sing. And then high intensity, this is when you're too breathless to even speak in full sentences. Now that's kind of a good way for you to determine when you're working out which intensity that you're at. And so again, try to shoot for that moderate intensity. Or that should at least be your goal. Maybe you need to start out lower and then work your way to moderate. How to stick with an exercise routine. There's a bunch of tips that I have for this. So I'll tell you each of them and then I'll go through each one individually. So choose an exercise routine that you enjoy. Set smaller goals. Be positive and reward yourself. Set realistic goals. Don't be so hard on yourself. Hold yourself accountable. Exercise with someone. Reframe what you think of as exercise. And schedule your workouts. So the first one, choose an exercise routine that you enjoy. This one's so important, and this sounds like a no-brainer, right? Well, if it was, it would not be my first tip. So start by jotting down your hobbies and your interests to find an activity that you can make a part of your exercise routine. For example, if you like the outdoors, you should go walking on a trail or just anywhere outside. If you like socializing, maybe some of our group classes are more up your alley. Make sure that you enjoy your exercise routine. Continued. So we're still talking about that. So whatever the case, find an activity that you can easily incorporate into your lifestyle and look forward to doing it consistently. If your workout is unpleasant or makes you feel clumsy or uncoordinated, you're unlikely to stick with it. So choose activities that fit your lifestyle and abilities and that also make you feel happy and confident. So set smaller goals. Another reason some are unable to stick to their fitness goals is that their goals are too big or too far away. So remember, improved fitness does not come easy or overnight. So taking smaller steps to reach your goal can be helpful. You want the result to be achievable. An example of a smaller goal is you want to lose 5 pounds in 1 month. An example of a bigger goal that's just not really realistic, too far away, is that you want to lose 50 pounds, okay? So be positive and reward yourself. It's easy to be hard on yourself for failing to stick to your exercise routine. This is something that I'm bad about this. I'm really hard on myself if when I don't stick to my routine or I get out of my routine. So I understand this one. This is why it's one of my tips, and I know a lot of other people do this. So sometimes that self-negativity can unwind the hard work you've put in and discourage you. So be positive. When you start a new routine, it's important to give yourself immediate rewards when you successfully complete a workout or reach a new fitness goal. I encourage you to practice a positive mindset and celebrate your little victories more and indulge in less of the self-criticism. So celebrating the small victories will reinforce the new behaviors and keep you more motivated to continue. Set SMART goals. People often set fitness goals that are unrealistic. So SMART stands for goals that are specific, measurable, attainable, relevant, and timely. So setting SMART goals can also help you achieve bigger goals that you may want to set for yourself over time. Let's talk about each of these. So specific is the first one. So make sure your goals are precise and stated in performance terms. For instance, if you want to improve your cardiovascular system in 6 months, so that's a specific goal. You didn't just say, oh, I want to start working out, or, in the next year, or I just want to get into an exercise routine. That's not very specific. So you want to improve your cardiovascular, is very specific what you want to work on, and you want to do it in the next 6 months. So that one's really important. Measurable. A goal is measurable when it is easy to determine if it has been accomplished. The cardio goal listed above is easily measured because 6 months from when you started, we can reassess you and you see whether you improved on your cardio or not in those 6 months. Achievable. One of the biggest mistakes people make while setting goals is that they set unattainable goals. The goals should be set high, but they also must be realistic. A goal to lose 20 pounds in 4 weeks is both unrealistic and it is absolutely unhealthy. That is not a good goal. That is not enough time to lose an entire 20 pounds. Relevant, your goals should be important to you. Do not set a goal just because your friends or your spouse has set that goal. Your goals are motivators to continue exercising. So you want to make sure that they're important and relevant to you. Okay, the next one is timely. Make sure each goal has a specific time frame for completion. This allows you to easily determine if it has been achieved. It also increases the likelihood that you will accomplish each goal since you set a time frame. For example, the goal, I want to lose 15 pounds in 10 weeks. That has a time frame. You're wanting to do the specific goal, lose the 15 pounds, and you want to do it in 10 weeks. Okay, so the next one is don't be so hard on yourself. None of us are perfect, so why do we expect to be perfect at our new workout routine? And why expect to get perfect results? Missed days of exercise or a cheat day are normal and bound to happen. So when you miss a day of exercise, rather than retreat to your old ways, just jump back into your routine like you never missed a beat. Try to focus on long-term consistency rather than short-term perfection and just keep moving. Hold yourself accountable. Nothing will change unless you commit to your plan. Having a friend or a family member check in on your progress will help hold you accountable. So purchasing a gym membership or hiring a trainer is a good way to motivate you and stick to your workouts since you want to get your money's worth. And also, you have someone holding you accountable if you have a trainer. Exercise with a friend. If you have an accountability partner and someone meeting you, you'll also be less likely to skip out. Studies show that you will also work out longer when you have a friend with you working out. Schedule your workouts. Scheduling your workouts are just as important as a doctor's appointment or a hair appointment or a nail appointment. If you're having trouble fitting exercise into your schedule, consider it an important appointment with yourself and mark it into your calendar. Plan your workouts for the time of day when you're most awake and energetic and when you were likely to do them. So if you're not a morning person, do not schedule on your calendar that you're going to do an exercise routine at 7 a.m. Pick a time that is ideal for you and you're most energetic, and schedule it in your calendar and do it each those days and times. Reframe what you think of as exercise. So research shows that all movement counts and any movement is always better than nothing. Studies have shown that one stumbling block for some is that they fail to take advantage of the exercise opportunities they can build into their daily lives. For example, taking the stairs instead of the elevator. And of course, that's if you can. I know some people cannot take the stairs, that's fine, but those of you who can, that would be a good way for you to get some extra exercise in. Walking instead of taking the shuttle, that's a short distance, or opening the door rather than using the automatic button, things like that. Walking also counts as valid exercise. Even mopping and vacuuming count as exercise, especially if you're doing it at a fast pace. And I know most of you aren't mopping and vacuuming, but some of you may do that every once in a while. Researchers now know that the health benefits of all these little movements add up. Statistics on exercise for elderly. So only 28 to 34% of adults ages 65 to 74 years are physically active. Only 35 to 44% of adults 75 years or older are physically active. There are many ways to keep yourself motivated throughout the year, but I hope these tips will help you get a jump start today. If you've been sedentary or you haven't been consistently working out, adding more movement into your day is a good place to start. Take your baby steps and remember that you must start somewhere. And Asher, this is my son again, he says, you all can do it. If you have any questions, please feel free to give me a call, or you can shoot me an email. Any questions about exercise or the exercise classes, or even about this presentation, if you have a question, give me a call, 512-454-4711. My extension is 2295. You can also email me, amanda@wmanor.com. And then if you would like to look over this presentation again, you can go ahead and check it out on the resident portal. It will be there, or I think it actually already is. So just go and check that out if you want to look over it again. Hope you all have enjoyed the presentation and have a great day. Thank you.